Pancreatic cancer is one of the deadliest forms of cancer, often progressing silently until it reaches an advanced stage. That's why recognizing early warning signs is critical. Catching it early could be the difference between life and death. But how can you tell if your body is trying to warn you? What are the silent symptoms you shouldn't ignore? In today's video, we're going to reveal 10 shocking symptoms of pancreatic cancer that could save your life or the life of someone you love. Make sure to stay until the end. We'll also share crucial tips on how to lower your risk and improve pancreatic health naturally. Let's dive in. Jaundice. Your skin might be telling you something is wrong. If you notice that your skin or eyes have taken on a yellowish tint, don't ignore it. This could be a major warning sign of pancreatic cancer. This condition, known as jaundice, happens when bilirubin, a yellow pigment, builds up in your bloodstream. Why does this happen? The pancreas sits near the bile ducts. If a tumor blocks the bile flow, bilirubin accumulates in the body, turning the skin and eyes yellow. Other symptoms that often come with jaundice: dark urine, despite drinking plenty of water, pale, clay-colored stools, and severe itching caused by bile salts in the skin. What should you do? If you notice any of these signs, see a doctor immediately. Jaundice can indicate other liver or gallbladder issues, but it's also one of the first visible symptoms of pancreatic cancer. Unexplained weight loss, a dangerous red flag. Losing weight without trying might sound great to some people, but rapid, unexplained weight loss can be a serious health warning. Why does pancreatic cancer cause weight loss? The pancreas helps digest food, but a tumor disrupts enzyme production, making it harder to absorb nutrients. The tumor can press against the stomach, making you feel full quickly, even after eating small meals. Cancer speeds up metabolism, causing the body to burn more calories. When should you be concerned? If you lose 5% or more of your body weight in 6 months or less, and you're not dieting or exercising differently, get checked out as soon as possible. Abdominal pain that won't go away. Most people experience stomach pain at some point, but persistent radiating pain, especially in the upper abdomen and back, can be a serious warning sign. How can you tell if it's pancreatic cancer? It worsens after eating, especially fatty foods. It radiates to your lower back, it doesn't improve with common pain relievers, and it progressively gets worse over time. What should you do? If this pain lasts for more than a few weeks or is accompanied by weight loss or jaundice, see a doctor immediately. Digestive problems, your gut might be in trouble. Because the pancreas plays a crucial role in digestion, pancreatic cancer can cause severe digestive issues including frequent diarrhea, floating, greasy stools, also known as steatorrhea, and bloating and gas after every meal. Why does this happen? Well, a tumor may block pancreatic enzyme production, making it difficult to digest fat and nutrients properly. What to watch for? If you notice persistent digestive issues, especially pale, greasy stools that stick to the toilet bowl, it's time to get checked. Loss of appetite. When eating feels like a chore. Have you lost interest in food? If you feel full after just a few bites, it could be a serious red flag. Why does pancreatic cancer cause loss of appetite? The tumor presses on the stomach, creating a constant feeling of fullness. Cancer changes the way your body signals hunger, making food seem unappealing. Foods may taste different, or you might feel nauseous after eating. When should you worry? If you're consistently eating less and losing weight without trying, see a doctor immediately. New onset diabetes, a surprising connection. Did you know that suddenly developing diabetes, especially after age 50, could be a warning sign of pancreatic cancer? How are diabetes and pancreatic cancer linked? The pancreas produces insulin, which regulates blood sugar. A tumor can damage insulin-producing cells, causing blood sugar to spike. Red flags to watch for: you've never had diabetes before but suddenly develop high blood sugar. You experience frequent thirst, fatigue, or blurry vision. Your diabetes is difficult to control, even with medication. If you or someone you know has new, unexplained diabetes, ask your doctor for further screening. Unbearable itching. A clue from your skin. Severe, persistent itching without a rash could be your body's way of signaling a serious problem. What causes this? When a tumor blocks the bile ducts, bile salts build up in the bloodstream, leading to intense, full-body itching. Other warning signs include yellow skin and eyes, jaundice, dark urine and pale stools, and persistent fatigue. If itching lasts for weeks and is worse at night, get checked immediately. Extreme fatigue. When rest isn't enough. Do you feel exhausted all the time, even after a full night's sleep? Are you finding it harder to complete daily tasks that used to be easy? This isn't normal tiredness. It could be a warning sign of something far more serious. Why does pancreatic cancer cause extreme fatigue? Fatigue caused by pancreatic cancer is different from everyday tiredness. It's a persistent, overwhelming exhaustion that doesn't improve with rest. Here's why. Cancer cells steal nutrients. Cancer feeds off the body's energy supply. Pancreatic cancer disrupts digestion, meaning your body isn't absorbing essential nutrients properly. The result? Severe energy depletion. Digestive problems lead to malnutrition. The pancreas plays a key role in breaking down food. If it's not functioning properly, your body can't absorb fats, proteins, and vitamins effectively, leaving you weak and drained. Chronic inflammation increases energy demand. Cancer causes widespread inflammation, forcing the body to work harder to fight the disease. This increases overall energy demand, making fatigue worse. What makes this different from regular tiredness? It doesn't go away with rest. No matter how much you sleep, you still wake up feeling drained. It interferes with daily life. You may find it difficult to work, exercise, or even perform simple household tasks. It's accompanied by other symptoms. Fatigue, combined with unexplained weight loss, appetite changes, or digestive issues, is a major red flag. When to see a doctor? If you're constantly exhausted for weeks or months, especially if you have no clear reason for feeling this way, don't brush it off. It's crucial to get tested and rule out serious health conditions, including pancreatic cancer. Blood clots, a hidden danger. Blood clots aren't something most people associate with cancer, but sudden, unexplained clotting can be a warning sign of pancreatic cancer. If you develop swelling, redness, or pain in your leg, it's time to take it seriously. Why does pancreatic cancer increase blood clot risk? Cancer triggers inflammation. Inflammation is the body's response to disease. Unfortunately, cancer-related inflammation makes the blood more likely to clot. Tumors release clotting substances. Pancreatic tumors release proteins into the bloodstream that increase clot formation. Reduced movement and circulation. As cancer progresses, it may cause reduced physical activity, which can further increase the risk of clots forming. Signs of a blood clot, DVT, deep vein thrombosis, swelling, redness, or pain in one leg, often in the calf, a warm sensation in the affected leg, and skin that appears discolored or tight. Signs of a pulmonary embolism, PE, a life-threatening condition, sudden shortness of breath, chest pain that worsens with deep breaths, and dizziness or fainting. When to seek emergency help. If you experience any of these symptoms, go to the emergency room immediately. A blood clot can quickly become life-threatening if it travels to the lungs. Early detection and treatment are crucial. Changes in stool and urine. What your body is telling you. Your stool and urine provide important clues about your health. If you notice significant, persistent changes, it could indicate serious digestive problems, including pancreatic cancer. What changes should you watch for? Pale, greasy, or floating stools. This indicates fat malabsorption, a sign that the pancreas isn't producing enough digestive enzymes. The result? Oily, foul-smelling stools that may float or stick to the toilet. Dark urine. When a pancreatic tumor blocks the bile ducts, bilirubin, a yellow pigment, builds up in the bloodstream and is excreted in the urine, causing it to turn dark brown or tea-colored. Blood in stool visible or hidden blood in stool can be a sign of internal bleeding. Dark, tarry stools may indicate bleeding in the upper digestive tract, while bright red blood may signal bleeding in the lower intestines. When should you worry? If changes in stool or urine persist for more than a few days, if these changes are accompanied by abdominal pain, jaundice, or fatigue, or if you experience frequent digestive issues like bloating, nausea, and loss of appetite. When to see a doctor? If your stool or urine suddenly changes and doesn't return to normal, schedule a medical exam immediately. These symptoms could indicate serious pancreatic dysfunction and should never be ignored. Pancreatic cancer is one of the deadliest cancers because it's often diagnosed too late. But by recognizing early symptoms, you increase your chances of catching it early, when treatment is more effective. What you can do today: listen to your body. If something feels off, don't ignore it. Get screened early, especially if you have a family history of pancreatic or digestive cancers. Stay proactive. Early detection saves lives. Lifestyle changes to support pancreatic health. Eat a diet rich in whole foods. Reduce processed foods, alcohol, and excessive sugar intake. Stay physically active. Exercise reduces inflammation and boosts immune function. Maintain a healthy weight. Obesity increases the risk of pancreatic cancer. Quit smoking. Smoking is a major risk factor for this disease. Have you or someone you know experienced these symptoms? Don't panic, but don't ignore them either. Schedule a checkup with your doctor to rule out serious conditions. Found this helpful? Smash that like button and share this video to help spread awareness. Subscribe now for more life-saving health tips. Stay safe and take care of your health.